especially among our esteemed colleagues from Egypt. My presentation today focuses on the crucial topic of transitioning from pediatric to adult care in pediatric inflammatory bowel disease. I'm Yuqi Qiao from Renji Hospital. This epidemiological study conducted in the United States reveals a concerning increase in the prevalence of inflammatory bowel disease when compared to previous published data from 2009. The study indicates that the overall prevalence of pediatric IBD has risen by a staggering 133%. Among children, Crohn's disease was found to be twice as prevalent as ulcerative colitis. The transition of care in pediatric IBD is a gradual process where adolescents learn to take personal responsibility for their health care. It typically starts in early adolescence and ends between the age of 18 and 23. Key barriers include psychological factors, self-management deficiencies, and systemic issues. Failure to transition successfully can impact emotional and physical health. Structured transitional care plans help shift responsibility, transfer records, and navigate the healthcare system. While the benefits of these plans are supported by experts' consensus, further research is needed to examine their impact on health outcomes. To ensure a smooth transition of care for patients with IBD moving from pediatric to adult medical care, it is crucial to have a structured and consistent approach to healthcare transition. The widely recognized GOT Transition Program offers a comprehensive roadmap for implementation. This program involves engaging stakeholders and focusing on 6 core elements: policy or guidance, tracking and monitoring, readiness, planning, transfer of care, and transition completion. It is important to know that this approach and timeline for transition applies to all patients entering adulthood, irrespective of whether they are changing healthcare providers or maintaining existing relationship with medicine, pediatric, or family medicine providers. Transition care plays a vital role in management of inflammatory bowel disease for several reasons. Around 25% for individuals with IBD are diagnosed before the age of 20, highlighting the significant proportion of pediatric patients affected by this condition. The incidence of IBD is increasing globally, further underscoring the importance of effective transition care. Furthermore, pediatric patients with IBD often experience more complex and severe disease compared to adults. This means that they require ongoing care and support as they transition into adulthood. By ensuring a smooth transition of care, healthcare providers can help these patients effectively manage their condition and prevent any disruptions in their treatment plan. A well-planned transition for pediatric patients with inflammatory bowel disease can bring several benefits. These include a reduction in emergency department visits, increased likelihood of being steroid-free, improved attendance for clinic visits, better adherence to medication, optimal growth, and decrease in the need for surgery. Barriers to a successful transition for pediatric patients with inflammatory bowel disease include differences in pediatric and adult IBD characteristics, psychological factors, patient knowledge and self-management skills, and systems-based factors. These barriers can hinder the smooth transfer of care and require attention to ensure a successful transition process. First, the differences between pediatric and adult IBD characteristics. We all know that pediatric and adult inflammatory bowel disease exhibit differences in several key aspects. Children with IBD commonly experience inflammation in upper gastrointestinal tract, while adults predominantly have involvement in colon and terminal ileum. Pediatric IBD tends to be more aggressive, extensive, and inflammatory in nature, with higher rates of complications. Treatment responses may also vary, with exclusive enteral nutrition being more effective in children. Additionally, pediatric patients may face growth and development issues, unlike adults. Psychological factors impeding transition. Children and adolescents with inflammatory bowel disease often experience a range of psychological issues. These can include challenges with behavioral and emotional functioning, as well as a decrease in health-related quality of life. Social functioning and family dynamics may also be impacted. Body image and self-esteem can be affected by physical symptoms of IBD. Stress and coping strategies become important for these individuals, as does their ability to manage their condition and adhere to treatment. Psychological therapy can play a crucial role in supporting children and adolescents with IBD. Additionally, education may need to be tailored to accommodate their needs. Here is a model for testing. 5 interventions for facilitating transitions. Developing a disease narrative for IBD involves explaining what the disease is and its daily symptoms, discussing the challenges and managing medications, procedures, and restrictions, and highlighting personal growth through the experience. Sharing this narrative helps raise awareness and promote understanding and support for those with IBD. Practice gratitude. To help with transition, it is important for patients to practice gratitude and surround themselves with positivity and support. This can be done by reflecting on what they are grateful for each day, identifying the people in their life who are there to help them cope with and manage their IBD, and acknowledging those they can share their thoughts and ideas with. Pay it forward. So here are 2 organizations, that one is in China, one is in the United States. So these are organizations that can help the patients engage in the IBD community. For adolescents going through the transition, it can be empowering to engage with the IBD community through volunteering and mentorship, by investing their time in helping others, such as mentoring newly diagnosed patients with IBD. They can boost their self-confidence and efficacy as they prepare to take on an adult patient identity. It's important to note that acts of kindness and philanthropy have been shown to increase happiness and overall life satisfaction. So the Chinese uh, in the slides show that education is the best medication. Help the others is help himself. To effectively transfer disease management tasks, it is important to set specific, measurable, achievable, relevant, and time-sensitive goals. We are aware that IBD patients can experience symptoms similar to those of IBS. This is closely related to gut-brain axis. The treatment approach may involve addressing both pain management and inflammation associated with IBD. Anti-inflammatory medications may have antidepressant and anti-anxiety properties. Conversely, antidepressant and anti-anxiety treatments may have a role in addressing inflammation. So psychological states of parents we cannot neglect. Parents of children with inflammatory bowel disease experience elevated levels of distress, with their child's health-related quality of life being the most significant factor. This distress is found to be more influential in anxiety, depression, and pain. Additionally, parents of children with inflammatory bowel disease also face comparable levels of psychological distress. Patient knowledge and self-management skills. And despite having confidence in naming their medication and dosage, adolescents have limited knowledge about their potential adverse effects of their medication. A significant number of surveyed patients relied on their parents for tasks such as scheduling appointments, requesting medical referrals, and contacting healthcare providers between visits. Here are the key points for care transition for IBD children in the United States at different ages. For children aged 12 to 14, patients should gain knowledge about their illness and medications. Parents play a primary role in guiding their child towards independence and should observe their progress. The pediatric team should emphasize the importance of self-management to the patient and family. For children aged 14 to 17, patients should acquire knowledge about medical procedure, tests, and basic medical care. Parents should encourage independence and teach their child about medical care as if they were on their own. The pediatric team should set goals and timelines for specific skills needed during the transition. They should also address sensitive topics and provide psychosocial monitoring. For children aged 17 to 18, patients should develop general self-management skills and make health and lifestyle decisions. Parents should start participating, letting go, and understand that they won't have access to medical information once child turns 18 without their approval. The pediatric team should prepare for the transfer of care, schedule final clinical visits, and offer a follow-up visit to discuss the patient's experience with the adult provider and address any remaining concerns. This is a checklist for independent management of IBD. If anyone is interested in the checklist, could visit the following website. Systems-based factors. Factors that can affect healthcare transition include the characteristics of healthcare system, the age at which transition occurs, the continuity of care, insurance coverage, the availability of support services, and culture and language factors. It's important to know that these systems-based factors can vary across different countries and healthcare systems, depending on national policies, resources, and priorities. Here are the key points for the transition. The key aspect of transitioning from pediatric to adult care in pediatric inflammatory bowel disease includes the importance of a sort of transition process which contributes to improve the patient outcomes. The transition is a gradual process that can begin at any age and ultimately leads to the transfer of care to adult providers. It is crucial to optimize care by fostering age-appropriate development of self-management skills over time, while there is no one-size-fits-all approach. Assessing readiness and the planning for the transfer of care in a deliberate manner can be beneficial. Thanks for your attention. Good evening, esteemed professors and distinguished guests.
Thank you, Professor Yuqi, for the very nice presentation and the very important topic as the incidence of pediatric IBD is rising and the transition to adulthood is very, very important in all aspects, psychological and of course medical. So this is very interesting lecture. Any questions?
Thank you, dear professor, for this elegant presentation. I want to ask you about the role of transition coordinator. And this role is better to be done by IBD nurse who is specialized in IBD or by physician.
Excuse me, could it be more clear? Because I cannot hear it very clearly. Sorry.
Transition coordinator, the person who coordinates the process of transition from pediatric to adult. What's your opinion about this role or about transition coordinator?
I think it's different between countries because most of the researchers are from the United States, I guess, because they have a very complete system about how to transition from childhood to adulthood. And in many developing countries or newly industrialized countries, we are forming this process for the children. I'm not sure in Egypt if children, how old is a child could see an adult doctor, I guess, for adult visit. In China, the age is 14 years old. I guess some children can visit an adult doctor when they are 14 years old and accompanied by their parents. So their transition, I think it's from 14 years old to 18 years old, because when they're 18 years old, they are adult and they can make decisions for themselves.
Yes. Okay. Thank you. Thank you.
Thank you, Professor Yuqi.
Thank you, Professor, for your interesting lecture. My question is why why the underestimation of the diagnosis of IBD in children? What's the cause of this underestimation? And we usually wait until adolescent or adult age to diagnose.
Adult age to diagnose, I think first they will belong to the pediatric doctors and they help to diagnose the patient and then transform to and they are transition to an adult doctor to see these patients. And I think there need to be a smooth transition, and there are a lot of works to do between these two, because the diseases for for young children, I guess they will have more severe diseases, I guess, and they will have more complications. And we need to pay more attention for these, because young age is one risk factors for Crohn's disease and also for ulcerative colitis. So they will be a bit different. And also, I have met some patient who has got genetic problems, and maybe we need also do some maybe sequencing, something like that, to have a more accurate diagnosis.
Thank you.
Thank you.